Over 100 years ago, the Flexner Report was released. It made revolutionary reforms in the education of healthcare professions. It was interesting because modern sciences formed the basis of healthcare professional education, which was divided into two subsequent parts. 2 years of biomedical sciences, followed by 2 years of clinical training at an academic center. Fast forward to 100 years later, modern sciences forms the crux of medical and health professional education today, which is divided into two subsequent parts. 2 years of biomedical sciences training and 2 years of clinical training at an academic center. Interesting. In the last century, we've seen incredible strides in clinical technology and acute care. We've battled infectious disease, we've doubled the human lifespan, and now with globalization, travel, and immigration, we're seeing a new wave of infectious, behavioral, and environmental threats to health. Our healthcare system has become increasingly complex and more costly, and all the while, healthcare professionals, our physicians, our nurses, our social workers, are bearing the brunt of this overburdened system. I practiced as a registered nurse for 3 years before entering medical school. I worked both full-time on a vascular surgery ward and in inner-city Calgary, where I held the hands of mentally ill and addicted individuals that I otherwise would never have come into contact with in my regular life. And now, 4 years later, I'm preparing for a graduation from medical school, and I find that I'm going to enter into a world of practice that is exactly the same as how I left it as a nurse. But there's promise of change. In 2010, the Lancet Commission's report on the education of health professions in the 21st century cited 3 waves of reform in the education of our health professionals. The first, at the turn of the 20th century, saw a scientific-based curricula, where the acquisition of knowledge and skills and the graduation of medical experts was the goal of the system. Shortly after that, we saw a problem-based instructional innovation where students were taught to be socialized to the values of their profession, and schools aimed to graduate professionals. The first wave of educational reform was informative. The second was formative. This third wave, which I am expecting will be coming soon, is the transformative learning model. Through transformative learning, we focus on the medical expert, on the professional, as well as developing leadership attributes and inviting students to apply the specific core competencies of their profession to the specific contexts in which they will practice and to the healthcare systems that they will influence. Transformative learning seeks to graduate not only medical experts and professionals, but change agents. We want to produce health advocates. In 2010, we conducted a cross-sectional survey of second-year medical students at the University of Alberta. 82% expressed an interest in receiving more leadership training in their medical education, and 74% expressed an interest in a leadership and advocacy program. In response to this, the U of A introduced the Health Advocacy and Leadership Program to first and second-year medical students, consisting of 3 components. The first is mentorship from a physician leader. The second, a self-directed project aimed at socially accountable endeavors. And the third was a series of seminars and idea incubators where students could share ideas, bounce ideas off each other, and motivate each other. It's exciting to see the projects that have taken place. A few of them, including a student who's helping with the establishment of a safe injection site. Another student is bringing health of immigrants and refugees to the forefront among medical students. Another seeks to enhance geriatric care in our communities. And shortly, Lisa will be sharing her project in injury prevention among young hockey players. Emeka Nzeku unfortunately cannot join us today, but I'd like to speak to his project on his behalf. He was interested in introducing productive curricula in interprofessional education. he wanted to expand the scope of HAL from one student seeking to develop a project and provide a service to the community to allowing several students to pick an area in which they were interested: immigrant refugee health, mental health, Aboriginal health, the homeless, and run with their projects from there. In doing so, he increased not only his service in the community, but service projects spearheaded by other students. Through his leadership, he was able to raise leaders around him who have now taken their projects to a whole new level. Mentorship has come from professors from various disciplines, community agencies, students from other disciplines, not necessarily healthcare related, and now he's seeking to make this course a part of interdisciplinary education here at the U of A. Now I'll allow Alyssa to share a few words about her project.
Thanks, Alyssa. As Alyssa said, my name is Kibria, and I'm a second-year medical student here at the University of Alberta. And so my project is called Healthy Hockey Heads, the 3H Study. And so where it came from was exactly what, as we were introduced as. It came from my past experience working as a practicing physical therapist, working with various young hockey athletes, and working with Hockey Alberta. We all know that hockey can be a dangerous sport, and that concussions are a serious injury. Yet statistics have shown that there's a rise in head injuries across all sports, including hockey, soccer, and football. So why is that? It doesn't really make too much sense. Well, how can we prevent it? Well, of course, we can talk about, stop hitting to the head, and let's stop from hitting from behind or anywhere from above the shoulder. But really what we need is true education and advocacy to these young hockey athletes. So that's exactly what we did in this Healthy Hockey Heads project. There's lots of resources out there, applications, tools, all at the click of a button that talk about concussions and how to reduce it and how to manage it. But most of them are accessed by coaches, by players, all over the age of 16 and their respective parents. But in hockey, the actual hitting starts at ages 11 and 12. It can range according to where you are in the country and so forth. But that's when they're going to start hitting, and we found no education tools that were guided towards them. So that's what we did. We created an education program and a manual. And what was it about? We talked about what was an actual concussion, and we talked about what was the brain and how it actually functions. And the players actually really liked that because it made sense when I talked about how did you get a concussion, what are the signs and symptoms, and so forth. And then we talked about how to manage it, the return to play guidelines, and overall how to prevent it, which was key. And we also showed everyone this YouTube video called Concussions One-on-One by Dr. Mike Evans, who's a physician in Toronto, who has also a passion in concussions, and the kids really liked it as well. So what ended up happening? Our method was pretty simple. We took about 12 teams, we divided them half randomly. Some of them got the control, some of them were in the control and they didn't get the education, and then some of them were in the intervention group and they got the education session. But I must say, our results were not what we expected. I thought I kind of had a foolproof plan here. I thought, yes, if we actually target this group, we're going to make a change. But what ended up happening, there was lots of barriers. We couldn't get players to comply to actually logging injuries. We couldn't get coaches to come out or parents to even sign a consent form to be a part of the project. And so what did I learn? We're in the process of doing debriefing sessions, collecting their injury logs, and also doing post-season questionnaires. And what I found was a number of things. A lot of the players stated that, yes, they think that injury reduction is actually important, that they actually are worried about getting hurt. Through our results, we had about 66 participants, and over 13% of the ages 11 and 12 already had one concussion, and over 6% had more than two. And over 77% of the parents and players and coaches never attended an injury reduction session. And they say it's important. But when we were doing our post-season questionnaires, a lot of them already knew what a concussion was, what the return to play guidelines were, but most of them were still getting hurt. Most of them still weren't following the return to play guidelines, and a lot of them were still hitting inappropriately. So the lessons I learned from this health advocacy project is number one, you never lose sight of focus of the patient in front of you. I think I got caught up in the whole procedure of ethics and trying to get a good study going and so forth. But really, injury reduction, education, this is not going to change behavior. We need more than lip service. These kids know what a concussion is, they know how to reduce it, but yet nothing is being done. We need powerful influences of change that actually care about the safety and well-being of our athletes who are going to make that change, and not just resources and little campaigns here and there. Number 2, and it's kind of like smoking. I was thinking about it, it's kind of like smoking, where if you have the pendulum swing to move society to reject it, that's when you're actually going to see the change, not just some of us kind of coming and going and doing that. Number 2, lesson 2, was the importance of point of care. We as medical students actually have a huge impact. I don't think we realize the positive impact we can have on the society and our healthcare system as a whole, and that we can play a part in grassroots movements and actually seeing how to empower a community. And through my project, I was actually able to see that. And Hal does that. Number 3, the importance of one-to-one mentorship. We just don't get this in medical school, and I think it plays a huge impact in our medical career. And the life tools and skills that I learned from my mentor, who is Dr. Fanning, I will take for the rest of my career, so thank you. And number 4, the importance of student leadership. We come into medical school being a student leader, but we don't really reinforce it as we go through. Dr. Turnbull, who is the past Canadian Medical Association president, said in 2011, he stated that we need to be seen talking for our patients, advocating, and actually being seen publicly advocating for our patients. And in medical school, we need to foster an environment where we promote strong leaders who will do just that. Well, so that was Healthy Hockey Heads.